Hi, this is Isabel Weathersby, and welcome back to another episode of 101 Thoughts. One very important quality to have as a healthcare professional is cultural competency. This means being able to provide quality care to patients from diverse backgrounds and cultures. This is an especially important skill for nurses, who spend more time in direct patient care than other professions. So what role does cultural competency play in nursing, and how do we teach it to nursing students? Here to talk to us about that today is Dr. Stephen Strobbe. Dr. Strobbe is a clinical professor at the University of Michigan School of Nursing in the Department of Psychiatry. He's board certified in both psychiatric and addictions nursing. His professional background has included clinical care, research, administration, and education. Dr. Strobbe has authored more than 50 peer-reviewed articles, position statements, book chapters, and other resources. He's been an invited speaker both nationally and internationally, including in the Federated States of Micronesia, Europe, South America, Southeast Asia, and Iceland. Dr. Strobbe, thanks for joining us. How are you today?
Well, thank you, Isabel, and thanks for the invitation. It's a pleasure to speak with you today.
So to start us off, let's zoom out a little bit and talk about healthcare a little more in general. One of the courses you teach is an undergraduate nursing course on communication in nursing. For those who may not be familiar, could you briefly describe the importance of communication in nursing or healthcare in general?
Absolutely. Well, communication is one of our most important skills, and it's foundational to safe and effective nursing. With the revision of the undergraduate nursing curriculum a few years ago, it was identified that we wanted to dedicate an entire course to communication, and I was tasked with both developing and then teaching this course, which has been an absolute pleasure because it gives me a chance to work with all of our incoming freshmen and to make sure that they have an understanding and appreciation for the importance of communication, how that contributes to safety and cultural competence, both in their academic and their upcoming professional careers.
Great. So how can cultural differences impact this very important communication in a healthcare setting?
We're all raised in our respective environments, which include important cultural considerations. It's easy for human beings in general, and maybe even Americans in particular, to practice a form of ethnocentrism, thinking that that however it is for us is how everybody lives, which would give us a really inaccurate assessment of some of both the challenges and strengths that other cultures bring to their people and their encounters with healthcare systems.
So obviously, culture plays an important role in communication and the quality of a patient's care. So are there any specific instances you can think of in Korea that helped shape your cultural competency?
Well, Isabel, if I may, probably my formational experiences were probably even broader than that. And then I hope they trickled down and have since influenced my practice. So early in my nursing career, I had an opportunity. I was invited to travel to the Federated States of Micronesia and to work with indigenous islanders there on topics related to substance use and mental health. It was an extraordinary opportunity. Spent several weeks there on 4 different islands in the Pacific, each of which had its own characteristic languages and customs. It was probably the most salient experience that I had in terms of what we call cultural humility. That idea that there's so much that we can learn about others and ourselves if we allow ourselves to be immersed in and receptive to what it is that's different from what it is that we already know. This is a rich culture that has thrived for thousands of years, and it was a humbling experience to be welcomed into their culture, into their society, and to see and appreciate their perspectives on life, the world, relationships that were different from our own, and that notion that somehow being invited in as an expert seemed like a real disconnect, because I thought, oh my gosh, they have such a rich philosophy and perspective on life. What is it that I can really teach them? And that laid the groundwork, I think, for me to be sensitive to, aware of, and really appreciate cultural differences and how it is that a willingness to learn more about other peoples can help us to become better citizens of the world, more effective nurses and teachers.
So, kind of going off of that, research suggests that exposure to other cultures is one of the most effective ways to develop cultural competency. Would you say that your experience working in other countries has helped you in that way?
Absolutely. One of the things I love about our School of Nursing here at the University of Michigan School of Nursing is the fact that we're able to offer opportunities for global health experiences to our undergraduate and graduate students. And I strongly encourage everyone to take advantage of those opportunities if you're able to do so. So research has indicated that oftentimes we rely almost exclusively in terms of education, in ways to try to help change and enhance people's attitudes. And there really are some inherent limitations to that. That some studies have shown that really the best, strongest, and most durable way for us to help open and change our attitudes is through contact with other people, not merely learning information, but being able to have that direct human to human interaction. And that helps better than anything to dissolve some of our preconceived notions associated with other people and their cultures.
So, in your experience working in these other countries and cultures, would you say that dealing with cultural differences is handled differently there than it is here in the US, or are there more similarities?
Both. There are some similarities and some differences. So, a number of unfortunate societal limitations or even plagues exist in other countries as well. So, other countries still have racial discrimination and prejudices. Just as one example, I've done a fair amount of work, spent a considerable amount of time in the country of Brazil, which I absolutely love. And one of the reasons that I like it so is the diversity. It seemed to me that maybe they had fewer racial frictions as we might have here in the United States, just because their population is so diverse. It has roots and representation from South America, from Europe, from Asia, all within this same heterogeneous population. And yet, the more time that I spent there, I mean, they also have as painful a history of slavery of African Americans as we do here in the United States, and that some of those racial prejudices and discriminations still persist there as well as here. So this is one example of some ways in which we are both different from and the same as members of other cultures.
Yeah. So obviously, cultural biases and prejudices are something that probably every healthcare system across the globe has to deal with on a large level. But what are some of the ways those prejudices can hurt patients on a more individual level?
At a very basic level, there's a very strong literature and research base that shows, for example, that Black, Indigenous, or people of color are viewed and treated differently even by their primary care providers. And that's true across disciplines, that assumptions are made in terms of their healthcare behaviors, around their resources, around their likelihood of adherence to recommendations, their vulnerabilities to certain chronic conditions. That can have a negative impact from the very beginning. Some providers, for example, whether it's conscious or unconscious, and I suspect that many or most of these biases are unconscious, that even the ways that they address their patients, the deference that they give to them based on their perceived educational levels or socioeconomic status, impact care and the options that are given them in terms of their health care. So there's a lot against which we need to guard ourselves and to be open to the fact that we're vulnerable to practicing, even unintentionally, some of these same untoward biases.
Right. So you mentioned that something healthcare professionals need to take into consideration is preventing their own personal biases from impacting patient care. But in a realistic world, there are bound to be situations where we might fail at that. In your experience, what are some things nurses can do after making a culturally insensitive mistake to help the situation?
Well, there's probably something that we can do before, during, and after. So, one of the most important aspects is simply the willingness to assess ourselves. Students in my classes will hear the first assessment that we conduct is not on our patients, it's on ourselves. And what is it that we're bringing to this patient provider encounter that could either enhance or detract from our interactions? And so, if we have some form of reaction to a particular person or a special population with whom we're working, it's important that we identify that and then work to make certain that that doesn't have a negative impact on the care that we deliver. During, that means that we still need, it doesn't just end when we walk into the door and introduce ourselves to our patient. Are we asking the kinds of questions in an open manner? Are we actively soliciting what are their healthcare practices and their preferences, which might be different from our own assumptions? How can we best integrate those into their care so that the outcomes are optimal? People are much more likely to adhere to and follow a course of care if they understand and hold the value of that. We're always vulnerable to making errors. Human beings inherently make mistakes. And historically in healthcare, there's been this real tension around, oh, I can't make a mistake, or if I do, I can't admit that. They're going to see me as not being professional. And the reality is that our intent to heal, a genuine desire to be helpful to other people goes a long way. And if we make a misstep, what we hope that we create an environment where a patient might feel comfortable if we address them incorrectly, for example. Have we made it clear that we would be receptive to feedback to help to correct those errors, and then a willingness to do that? A simple, oh, I'm sorry if I misunderstood that, or if I mispronounced your name, or the way you prefer to be addressed. Most people are far more forgiving toward us than we are toward ourselves. So I think our intent, our desire to be helpful, can go a long way toward, one, helping to reduce the likelihood of making those errors. Two, actively inviting our patients to inform us about what's going to be most helpful to them. And then, since we're human beings, we make a mistake, we acknowledge it, try to make amends, repair that error, and move on in the best ways that we can.
Great, thank you. That was really insightful. All right, let's change gears a little and talk about cultural competency education in nursing programs. So, cultural competence is a topic you teach in your undergraduate class. And as a part of this subject, you had your nursing students complete the Intercultural Development Inventory, also known as the IDI, which is a survey that assesses cultural competency and provides steps for self-improvement. What led you to include this in your curriculum?
Isabel, that's a great question, and I love sharing this story. Those who are here at the University of Michigan School of Nursing know that we have a dedicated Chief Inclusion Officer, Dr. Rushika Patel, who is a great resource to students, to staff, and to faculty. And I'd mentioned that I was charged with designing a new course and teaching a new course in communications in conjunction with the new curriculum. And I thought, well, this was a great opportunity, but I realized, oh my gosh, up until that point, I'd never taught any of our undergraduate students until they'd reached their junior level. And I thought, the reality is I'm not really sure about everything that the incoming students have been exposed to in terms of diversity, equity, and inclusion. And I certainly don't want to miss an opportunity for us to do even better and to lay a solid foundation for our incoming freshman students. So I asked Dr. Patel if we could meet. And graciously, she agreed, and we had a great conversation. So I put to her the question, so Dr. Patel, if we could do anything that you wanted in relation to this class to help get off to a good footing, what would that be? And she said, I have always wanted for us to be able to partner with more directly and purposefully with the Trotter Multicultural Center, and for our students to participate in the IDI, the Intercultural Development Inventory, to see what we can learn in ways that we can better shape our programming to prepare our nurses to bring cultural competency, DEI principles into their education and practice. So for some few years now, we've had this direct partnership with some representatives from Trotter Multicultural Center. And this has included administering the IDI and then reviewing the results at a group level with our freshman class.
So going off of that, what are some insights you think the IDI and other surveys like it can bring to students?
One is the important realization that this is a process, that we commit to continued growth and development throughout our academic and professional careers, and that insightfully, most of us think we're better than we actually are in terms of understanding and implementing certain of these principles. That this covers a trajectory, from denial that there are cultural differences or that they are important, through additional steps of polarization, minimization, acceptance, and ultimately, ideally, adaptation. Are we able to really be able to adapt ourselves and our practice toward increased competence and comfort in being able to negotiate and move around in different cultural spaces? So it's a process. None of us ever finishes this journey. That making the commitment, realizing the importance of having some sensitivity and knowledge, skills, and attitudes around these principles will help to make us better nurses, and I suspect better citizens of the world as well.
Yeah, those sound like very important things for students to grasp, especially nursing students. So kind of on the flip side, are there any areas of learning to be culturally competent that you think the IDI and surveys like it might not be as effective in?
Well, this is only one slice. I mean, when we think about diversity, equity, and inclusion, it's again, it's not just knowledge about that phenomenon, but it's a commitment to integrate certain of these principles into our practices. So we've all heard the saying, actions speak louder than words. And so we need to be willing to put certain of these principles into practice. To be willing to take some healthy risks at reaching out, inviting others to inform us about how we can become more supportive, empathic, and effective providers. So while taking an inventory is an important maybe an important first step, it's only that. It's a first step on what we hope is a lifelong journey toward enrichment, both for our own benefit as well as the patients and families and colleagues with whom we work.
Yeah, it seems like from what I've read that translating theory and what you've learned in a classroom about being culturally competent into actual practice is one of the biggest challenges in this field. In your experience, are there any methods that you've seen that can help with that translation?
Absolutely, and it brings us right back to the very beginning of our conversation, Isabel, and that was around the importance of our putting ourselves in positions to be in contact with others whose cultures might be different from ours. That includes, but isn't limited to, being in other countries. We have a multitude of cultures right within our own nation, and yet most of us live very insulated, segregated lives. And as a result of that, we're really robbing ourselves and our neighbors of the opportunity to learn from and be enriched by others.
So like we've mentioned, surveys like the IDI are only one of countless different formats that cultural competency education can take. If time or resources weren't an issue, are there any other kinds of cultural competency education you like to try with your students?
Well, we have some of those opportunities right here at the School of Nursing. There are courses that are available that allow us to travel, learn, and practice in other settings, both within our own country and in other countries. And to my mind, there really is no replacement or substitute for having that kind of direct contact with others who might share cultural differences from our own, often very narrow, limited, insular, isolated, even segregated experiences.
Great. So, the inclusion of cultural competency in nursing education is something that's been expanding in the last few decades. Would you say that it's addressed differently in today's nursing programs than it was when you were in school?
Yes, the fact that, well, here at the University of Michigan and certainly other premier learning institutions, our own president, Mark Schlissel, since his arrival, identified diversity, equity, and inclusion, or DEI, as a foundational value and principle here at the University of Michigan, and that we are fortunate in our School of Nursing to have a dedicated Chief Inclusion Officer in Dr. Rushika Patel, the support of our Dean, the availability of resources and learning and opportunities to be able to expand our exposure to these principles and how best to put them into action on a real basis. And that includes, for many of us, that includes a willingness to, as I said, for self-assessment and a willingness to learn, to examine what might be some uncomfortable realities about our own upbringing, about some of our own attitudes or assumptions and beliefs, and try to make space for and to honor and embrace those differences between and among us as human beings.
Yeah, so as you mentioned earlier, the University of Michigan, specifically the School of Nursing, has made changes to its undergraduate nursing program in the last few years, which led to the creation of the undergraduate course you teach. So, speaking in slightly broader terms, though, do you think the changes made will help students become more culturally competent?
It can, if we're willing to be open to that. You can't force someone to learn something, but we can certainly help to create circumstances that invite them to do that. And I think that quality institutional attitudes, the availability of resources, some expectations around what constitutes respectful communication, for example, to allow for those differences, and that we do not accept or tolerate rudeness, insensitivity, or diminishment of individuals' inherent worth.
So, like you mentioned, it can be very difficult to teach someone if they're not willing to learn. And some of the research on cultural competency education has raised the question of how to teach students who are resistant to learning to be culturally competent. In your experience as a clinical or classroom instructor, have you ever encountered a student who didn't want to learn to be accepting?
People may vary in their willingness at any given moment, but I consider myself really fortunate to be a professor in nursing, because the one thing that really unifies us as a profession is a genuine desire to be of help to others. And that can go a long way toward overcoming what might have been some other developmental or sociocultural impediments. So we can still be aware of the fact that all of us, students included, will be at different points in this journey. And we don't immediately move from using IDI terminology, from denial that cultural differences exist or are important, to adaptation at the end. But what can we do to help move people along that continuum? If we recognize this as a process, if we're willing to meet people where they are and genuinely try to assist them in increasing our own awareness and our receptivity to growth, that will go a long way.
Yeah. So, as you mentioned, cultural competency is a continuous process. It's not something you can necessarily check off or achieve. So, what are some things you think nurses can do to continue developing their cultural competency after they leave school and as they enter their careers?
Well, certainly the continuous self-assessment is one important element. Identifying where we may have some gaps or shortcomings in terms of our own education and experience. Reading renowned authors who have been in situations that are different from our own to enhance our own insights and expand our capacity for empathy, for being willing to engage in discussions and to acknowledge what some of our own blind spots might be. And then just to mention it again, if we are willing, there are few things that can help to change our minds and our hearts as much as coming in contact with others whose experiences have been different from our own. So I consider travel can and should change people, and that there are few things that are as powerful or as long lasting as having meaningful exchanges with people whose experience has been different from our own.
Alright, to wrap us up, our final question for you today is there anything you hope to see in the future of nursing education regarding cultural competency?
That's a great question. It feels as if we've got a lot on our plate right now, so trying to do a good job with what it is that's already been identified would be a great starting point. Although I'm certainly always open to hearing new ideas and approaches that can make us even better at what it is that we're doing and trying to do.
Alright, Dr. Strobbe, thank you so much for joining us. I hope you have a good rest of your day.
It was my pleasure. Thank you so much.
I hope you enjoyed hearing from Dr. Stephen Strobbe, and I hope we can all gain a new appreciation for the importance of new experiences and self-assessment in learning to be accepting. Thank you for listening, and you can check out the other videos on this channel for more student interviews and documentaries. Have a nice day.